Lesson number 5, rinse and spray against COVID. Ari, what does that mean?
Well, that basically falls under the subject of disinfection. And we know that there are many substances available for disinfection, and we know that certain subjects are still very difficult to get, like Clorox and other things. And the latest in our research has been that a very old product, a very, very old product that has been used over 5,000 years, the old Egyptians have used it, iodine has been used for wound disinfection and disinfection of surfaces, and including in the mouth. The only new innovation, what happened now, is that iodine is being used now in an ionized way, meaning the molecules have been charged in a certain way that they attack a better surface and attack the virus in contact and kill it within a very, very short way. So we have instituted in our office now, when a patient is coming in, we used to rinse with many different kind of antimicrobial substances. We included now in our new regimen that we rinse first with peroxyl, which is a diluted form of peroxide to loosen up the plaque, remove the obvious bacteria. And then we ask the patient to rinse and gargle with this iodine product that, by the way, is available from Iodine or Iotech, and you can just Google it. They have a consumer division, and you can order it directly from them. This particular product that Ziv just shows is a different form of iodine that has not been ionized, and it was very, very popular. For people who have watched our first webinar, you remember that we modeled our office on 2 institutions, one in Germany and one in Korea, that treated a lot of people, including Korea, at much earlier than we were confronted with the COVID virus. And basically, both those institutions, their staff as well as their patient, had no COVID illness. And one of the main things that they use, besides what we share with you, is the use of iodine and betadine rinses. Unfortunately, this particular product that I'm showing you, the betadine, is very difficult to get now, but we were very fortunate that an American scientist and institution is now producing the iorins in Florida for doctor use, as well as for the use commercially available for patients. So I would encourage everybody to think about having, besides the regular mouthwash, to gargle with iodine, especially the iorins that you can get from Iotech. And here you have it. And the important part of it is that it's not only a rinse that cleans wounds in the mouth, that removes bacteria, but the important part for the iodine, either in the betadine form or in the iorins form, is that you have to gargle with it for 30 to 60 seconds. What research has shown now is that the virus can enter mostly through the mouth or the nose, a little bit maybe even through the eye if you touch it, but the virus enters the body and gets stuck in the oral throat area. That is where the body attacks it and the immune system kills it. And if it doesn't, then unfortunately it travels into the body and into your lungs and produces the damage. So this iodine rinse should be mostly used for gargling. And anytime you feel like that you have been exposed to more people than you feel comfortable, or you've been in the outside, I think it's very beneficial to have it at home and not only rinse with it, but also use it as a gargling device. And the next picture, Dr. Simon can show you that everybody who has been a patient of us knows to the right the peroxyl that was antibacterial, but really has not a total capacity for antiviral. We have advocated the use of Closis. It's a great mouthwash that after brushing and flossing at night, if you rinse with it, it removes a lot of bacteria, and you wake up in the morning thinking that you just brushed your teeth, you don't have any coating. But unfortunately, all those products, including the Peridex to the left that are antibacterial, don't have the high capacity to be antiviral. And so the Iorinse is now our gold standard for prevention of COVID. So basically, we used to, a couple of months ago, to rinse only was the closest, and then the Iorinse. We change our protocol now, and we are using now the Peroxo because it foams, it removes all the debris, including the bacteria. And then before the patient sits down for the treatment, we are rinsing with the Iorinse and gargling with it. When you come into our office, you will see in the operatory that we have two sinks, one assigned to the patient, one assigned to the doctors or the nurses. Here you see the rinses being prepared on the patient side. Don't get alarmed when you see the red and the blue signs in the operatories. Dr. Simon will get into this, but basically the red means everything from the outside, including you, the patient coming in. That's the side where we still disinfect and it's totally clean, but it's dedicated to the patient, including a surface for you to put your phone down, including surfaces to put your belongings. And the blue is basically the disinfected area where we keep everything on top of it sterile. So Dr. Simon will go a little bit more into the details of it, but don't be alarmed. This is basically just an indication for us to keep those areas separate.
Excellent. So yeah, Ari, thank you. We are very territorial. We wanted to make sure that things are very visible, not just to us, but also to our patients. So we can direct you and tell you, this is your area to put down your phone, put down your bag. Here's a little bag for your mask. Here's your rinsing. And rather than not having a clear distinction between the different territories. And here's a very simple example. We look at red as things that come from the outside. And as a patient, you are coming from the outside. So technically, we assign the color red to your area. And that's when we disinfect our mail. We turn it from red into blue until it gets into our personal mailbox so we can check our mail. It goes through a process, but you'll see those signs in the operatories. And again, the red is for you, the blue is for us. For example, here's some surgical equipment. You wouldn't want to put your stuff next to it. And you would rather put it here. And if you made a mistake, it's not a big deal. We'll disinfect the surface and we will guide you to your territory. Okay.
If I may interject, Ziv, it just comes to my mind that even so we are doing this, but not assigning any colors. I think for our patient, it might be worthwhile to think about that you don't have to put colors on. But again, when you come from the outside to your home, you should have a dedicated red area in the entrance of your apartment house or wherever you are living, and know that that's where you're depositing either your clothes that are contaminated, your shoes or whatever, and then you step into the main part of the house that should be blue and that should be clean. And assuming that it's clean, therefore, as Dr. Simon has said, you don't have to wash your hands every 30 minutes. But please dedicate a certain area in your house where you are coming in unclean from the outside and dedicate this area for your protection.
Thank you, Ari. And here is actually the front desk also has the same principle where if you needed a pen, we're going to try and stay away from signing things. We're moving into the digital signing on your phone, our consent forms, our treatment plans, your payments will be fully digital in the next probably few weeks. But if there's a pen, we will make sure that we give you a sanitized pen, and then when you're done, you put it in the red
Dear patient,
section.
It hasn't been easy to stay home, and it hasn't been easy to close our practice for all this time. But although we were closed, we started to plan our return. We envisioned a practice that is adapted to the current situation, a practice where you feel comfortable coming in and being treated in it, a practice that is corona safe. So we designed a workflow that addresses this, a workflow that is efficient in time and minimizes interactions and the number of people in the office. So how can we achieve that? Be efficient and practical and also deliver high-end treatment. Plus, make you feel how much we care about you. So here is how it goes. Your appointment will be scheduled over the phone, as always. We will be asking a few extra questions on the phone as part of our screening process. Thank you for your time answering them. You will get an appointment reminders to your email and phone as a text message. These would have a quick questionnaire that you will be answering. It's called the wellness form. We are doing this to ensure no patients with symptoms enter our office. We apply the same to the doctors and all team members in our practice. We also have a special protocol for handling mail and packages. These get disinfected before entering the practice. Now here's the first big difference. Don't just walk in. We will text you when we are ready for you. Then walk in. Make sure you wear a mask. Our office is a masked environment. If you don't have a mask, we'll provide one to you. We got you covered. In case you didn't fill out the wellness form, you'll fill it out there. It only takes a few seconds. By the way, we only allow scheduled patients to come in. We have a special protocol for all patients, which is the same as we are using for our staff. We will take your temperature, we'll ask you to sanitize your hands. You will see HEPA filters scattered around the office. These machines filter and remove all particles in the air, including the COVID virus. Then you're off to your treatment. We will ask you to pre-rinse before your treatment. This reduces the number of microorganisms in your mouth and minimizes contamination. Our treatment room has been prepared prior to your arrival to maximize the safety of your treatment. On top of that, we are using a special fogger that kills all viruses with a non-toxic solution. In our new protocols, we don't produce aerosols during a cleaning, and we will manually polish your teeth. As things evolve, we will keep you posted on the new protocols. If you are planned to have a procedure done, your check-in process will be the same. We will bring you to the treatment room, and besides the doctors and the assistants and the HEPA filter, you'll see another machine. This is a device that suctions all the aerosols and captures them. Look at it like a large vacuum cleaner for medical purposes. Our doctors and assistants will wear personal protective equipment, including a gown, a cap, a special mask, and a shield. It takes some time to put them on, but it's still us below. As much as we would want to, we will not be able to shake your hand. We are sorry. During the treatment, as always, we will focus on making sure you are comfortable. Medical offices tend to be cold, so make sure to bring a jacket or even a blanket. Feel free to use your phone or other devices to listen to music during your treatment. After getting post-operative instructions and some medications, you're set to go. Your follow-up appointment has already been scheduled and your payment has been processed. Thank you for entrusting us with your treatment. We appreciate your confidence. Speedy recovery. We got you covered.